you very much, Mr Deputy Speaker. I thank the Backbench Business Committee for granting this debate, which is the third in a trilogy which the honourable member for Bradford South and myself have secured. I think this in itself tells a sad and sorry story. Complaints about access to NHS dentistry have been the #1 item in my inbox for getting on for 2 years. And whilst there is a particular challenge in Suffolk and Norfolk, I am conscious that this is very much a national crisis. The fundamental causes of the collapse of NHS dentistry go back over 25 years, with a gradual withdrawal of funding by successive governments and the poorly thought through 2006 NHS contract. COVID, Mr Deputy Speaker, was the final straw which brought the edifice crashing down. The challenge which is now in front of us is to put NHS dentistry on a secured long-term footing, but to do so in a way that enables our constituents, many of whom are in acute agony, to see a dentist straight away. Okay, yes.
Can I, through you, sir, thank my honourable friend for his part in getting the successive debates, and in terms of emergency dentistry, in my constituency, people are asked to travel an hour and a half by public transport for emergency treatment. Great change has been made in the last 3 months. Can we get that change improved in the next 3 months so that doesn't happen anymore?
I thank my honourable friend, the Father of the House, for that intervention. I think we all have tales of constituents who've had to go a long way to see an NHS dentist. That's if they can find an NHS dentist at all. And in my area, Lowestoft, people have had to travel to Basildon, where actually going by public transport is not particularly straightforward. The task of delivering the plan for NHS dentistry is placed on the shoulders of my honourable friend, the member for Harborough. The purpose of this debate, from my perspective, is to be constructive and to provide him with ideas and suggestions that could be included in this plan. This plan, Mr Deputy Speaker, should be ambitious, it should be visionary, and it should be innovative, and it must not just be a sticking plaster to get us through the immediate crisis. To do this, and to ensure that our constituents are able to see a truly local NHS dentist quickly, there are 3 immediate short-term challenges that must be addressed. First of all, the sum of, I think it's getting up to £500 million, which is due to be clawed back into the main NHS budget, should remain available exclusively for NHS dentistry this coming year. Secondly, in the short term, there is a need to recruit more dentists from overseas to address the acute shortage of NHS dentists. I acknowledge the measures that the government put in place, as the Minister so set out to me in the question I asked on Tuesday, but more does need to be done to get this queue eliminated as quickly as possible. And thirdly, in the short term, Mr Deputy Speaker, the 2006 NHS contract needs replacing, and we must move completely away from the discredited UDA system. Mr Deputy Speaker, in the longer term, the ingredients for rebuilding the NHS dentistry and transforming it into a system fit for the 21st century, of which we can be justifiably proud, are as follows. First of all, as I've already mentioned, we need to put in place that new contract, as well as addressing the current contract's fatal flaw. It should facilitate a focus on prevention, and it should motivate dentists and dental practitioners to work in rural and coastal areas such as Suffolk and Norfolk. Secondly, a long-term fair funding system should be put in place. I acknowledge that governments do not like ring fencing, but NHS dentistry must be provided with an assurance that the funds are available to make long-term strategic investments that ensure that the service will be both resilient and robust. Thirdly, Mr Deputy Speaker, the arrangements for recruiting and retention need to be significantly improved. Dentistry must feature prominently in the government's forthcoming NHS and social care workforce plan. Many colleagues, including myself, have highlighted the need for dentistry schools in their areas, and locally, both the University of East Anglia and the University of Suffolk have come forward with proposals. In East Anglia, Mr Deputy Speaker, my sense is that there is a vacuum that must be filled, but I am mindful that a strategic approach right across the country needs to be pursued as to where dentistry schools are best located, and I would be grateful if my honourable friend could commit to carrying out such an assessment. In the meantime, I would urge him to immediately support the University of Suffolk's Dental Community Interest Company, which has the twin benefits of providing much-needed NHS dental treatments and training in such areas as dental therapy and hygiene. Mr Deputy Speaker, there is also a need to improve accountability and transparency of NHS dentistry, and the move to integrated care boards, which happened throughout much of the country on the 1st of April, including locally to the Norfolk and Waveney Integrated Care Board, is very much a step in direction, and in our local area they are taking the steps to put in place a long-term plan and also to ensure proper representation from dentists. Finally, Mr Deputy Speaker, at the heart of any health strategy must be prevention. Such an approach will help spare people from hours of agony, and ultimately it will impose less of a burden on the public purse. I shall briefly outline 3 possible strands to intervention. Firstly, the government must press ahead with plans to fluoridate the water supply. I think all the evidence is that this will bring significant results. Secondly, we must come up with a strategy for promoting better oral health care for children. In 2021, with support from local councillors, Lowestoft Rising provided free toothbrushes and toothpaste to the under 7s. The take-up was very high, the feedback was extremely positive, and it was recommended by them that these products should be exempted from VAT. I would urge my honourable friend to promote this policy with the Treasury. Thirdly, as we've heard, we must not forget the elderly, particularly those in care homes, and this is something I think must be covered in the new dental contract. In conclusion, the emergence of dental deserts across the country, which are now joining up to create an area of Sahara proportions, is a crisis that must be tackled head-on with proper funding, root and branch reform, and bold and imaginative policies. My sense and my hope, Mr Deputy Speaker, is that the Minister is up for this challenge, and I look forward to the publication of the Government's NHS Dentistry Plan. As I've said, this is the 3rd Backbench Business Committee debate that the Honourable Member for Bradford South and I have secured, and I do hope that a 4th won't be necessary. Thank you.
Dame Diana Johnson.
Thank you.